as people wrote to me and texted me and called me and said, what does this mean? What did the county just say? We are so lucky to live in a county with such professional public health officials, people like Dr. Ferrer and her team, people who are working around the clock to save lives. And it is the job of public health officials, from Dr. Fauci at the national level to Dr. Ferrer here in Los Angeles, to tell us the news and to tell it straight. It's the job of those of us who are lucky enough to be your elected representatives to make tough calls based on that advice, to make sure that we interpret the data, share with you the information, and walk you through how we make decisions. And I want to say two things. One is no, Los Angeles County is not going to be on lockdown for 3 months. Look at this past week and this week, and brave steps forward. This hasn't been a week of retreat. We've had to make tough calls, but based on the advice of our public health officials and people out there who are suffering, to take steps forward, to do things like opening up our trails this weekend, to get some of our stores back in business with curbside and doorside pickup, and to allow us today to go even further. Today was a great day for Los Angeles as people went back to our iconic beaches. And thank you to everybody who is taking part in opening up our beaches in a safe way to get us back to those places that fill our souls, that remind us of what's so beautiful here in Los Angeles, and give us hope for the steps and the days ahead. As I've been saying, we're not moving beyond COVID-19. We're learning how to live with it. The threat is just as great today as it was the first day that COVID-19 and this novel coronavirus landed in LA. And that means that it's not up to elected officials or appointed officials. It's up to all of us to care for one another, to care for our collective health and the health of our economy. And certainly I have tremendous hope in the days ahead that we can continue taking steps together. All the cities of this county, the county, together with our region, to make sure that we are managing saving lives and building hope back into this amazing city of angels. So no, we won't be shut down for 3 more months. That's not what I heard. That's not what I expect. That's not what I hope. And as I said, we're learning more about this virus every single day. It's teaching us lessons we wish we didn't have to learn, but lessons that are helping us, whether it's been construction trades or whether it's been our farmers markets, now our retail and golf courses and recreation, our beaches today and more, of the ways that we can carve back a life that gives us that spiritual nourishment that we need, that gives us the material prosperity that so many of us miss, and give us hope that our economy and our health can both recover in the days ahead. As an Angelino, I was overjoyed to see neighborhood businesses reopen across the city for people to buy books and clothes, flowers and shoes for Mother's Day. But tonight, all retail locations, from electronics to beauty stores, will now be open for curbside and doorside, you can walk up, pickup and delivery. And we are also allowing manufacturing, and we've seen wonderful manufacturing continue since the beginning of this, especially around PPE and face masks. But all manufacturing that supports any retail that is opening at a reduced capacity as long as they can adhere to infection and distancing protocols. These are great steps. And I want to thank everybody from all the industry groups that have consulted with the county, with the city of LA, and throughout this state to figure out the ways to do this safely. And I know so many of you, employees and employers, are working around the clock to protect your people and to protect your business while we protect your health. And with people already back at golf courses and our trails, today, as I mentioned, we opened up our beaches to active recreation, which is a fancy way of saying now we can swim, walk, jog, surf, all along the coastline. Parking lots and piers and beach bike paths and concessions remain closed, but let's take advantage of what is there. See those beautiful waves that have been glowing in Venice and throughout Los Angeles, and remind ourselves of what makes LA so great while doing it safely. And also to remind you, no gatherings are allowed on our beaches. Sunbathing, sitting, group sports are not permitted. And if you go to the beach, you must wear a face covering and maintain proper physical distancing from others. In other exciting news today, the county, and our orders will mirror this, have allowed tennis and pickleball courts, archery ranges, equestrian centers, model airplane areas, and community gardens at city facilities to open in private facilities tomorrow. We will also begin our Slow Streets program here in the city of Los Angeles, and I want to thank Again, our chair of our transportation committee, Mike Bonin, and other council members, and the neighborhood councils and neighborhood groups that have worked so hard to get there. This weekend, we'll temporarily close neighborhood streets in many of our neighborhoods to cars to give people a little bit more room to do what we're all doing, walking in the neighborhood, running, biking, help families get out there safely with strollers and other things without running into each other on the curbs and endangering our public health. Now, these are big steps, but they also come with big responsibility. But I'm confident in you that we can make these changes and meet head on not just the threat of this virus, but the hope of this moment with these new permissions. Now, one other thing. I know people have asked, when can I wear a face mask? When should I wear a face mask? Today's orders also simplify this for all Angelenos. We're requiring all Angelenos, except for small children or those with disabilities that might be harmed by a face mask, to wear a face covering when they are near others who do not live in your own household. Simply put, bring your mask with you whenever you leave the home. You never know when you're going to bump into somebody round a corner in a park and see somebody. Have your mask with you when you leave your house. And as long as you're not doing a solitary activity or with your own household, put that mask on always now, and that is a requirement. That will help us get more freedoms, open up more parts of our city, and know that the numbers won't go up of the spread of coronavirus. We won't take steps forward when we're just yelling or complaining. It'll be when we're hopeful and responsible, and when we own our collective health together. This should be an exciting week, not a depressing one, and I hope that you feel some of those brave steps forward and that that's helped clarify what was and what wasn't said yesterday. And depending on the public health conditions of the city, we will continue to adjust the order. There will need to be a public health order in place till we're done with this. In fact, every country that is so-called open and every state that is so-called open have public health orders. Ours is just called Safer at Home, but that doesn't mean that there'll be a full lockdown. There never has been, and moving forward, hopefully there'll be less and less of that. There might be moments when we see the numbers go up. We'll have to make the tough calls, do what's responsible, and save lives. But if we're all in this together and figure out smart ways that this virus is teaching us to get through living with it safely, we will continue to see forward progress. It's a process. It's not about a date certain. It's not about one date, as I've always said, where the light switch is flipped on. This is about a series of circuit breakers that we're already starting to flip on to see more light in what has been very dark days. But we also can't jump too far ahead. So our updated order doesn't have a specific end date, not because, and I want to say it again, everybody's locked down forever. It's because we still need to take the guidance of our public health professionals. We can't stop physical distancing, so we need to have that in an order. We can't take off those facial coverings, so that needs to be in an order. We have to not just say we care about our nurses and our doctors and our medical professionals. We need to make sure we are protecting them, and that's in the order. Our vulnerable populations, like our seniors, people with underlying medical conditions, we're going to have to be extra careful with them so that they don't die disproportionately. That needs to be in an order. So that's all that was said, is that the order will continue to be out there, but we will continue to intelligently and with the input of all Angelenos and all industries look at ways that we can continue to modify that safely and take steps forward. The city and the county have a roadmap. After today's new orders, our next steps are to keep monitoring public health conditions. It takes about 3 weeks to see the impact, probably about 4 to 6 weeks to really understand the full cycle of whether people get infected, reinfect others, and whether deaths start to go up. This is really tough work. And I want to remind you, this is about saving the lives of people we know. It pisses me off when I hear people saying, oh, those are just old people. Did you know that so many of the people that are dying are our parents and our grandparents and our neighbors? Many of them are veterans who have served our country. And even if they have fewer years left on their calendar than some of us, each one of those years is precious. When I hear people say, throw everything open, and then I talk to nurses who are saying, we are still scared to death. Some of us aren't even going home because we work in emergency rooms and we haven't seen our kids in weeks and months. Remember them, please. And let that inform you when you are about to run off without the mask that's sitting there by your front door. When you're thinking, oh, maybe I can skirt the rules and nobody will see. This is about our collective caring and our collective health together. And I'm going to keep you informed every step of the way with the information I have and how these decisions are being made. And I've said it before and I'll say it again. These changes are guidance. Businesses are not mandated to open. Just because you can, take your time to do it safely. Protect your employees, protect your customers, protect your business. And if you can operate safely, go ahead. But if you can't, wait until you can. If you need more time, take it. And when you open, all businesses need to have your completed retail establishment distancing checklist, which is something the county public health department mandates, posted. It's good to post that for you and for your customers to know it's safe for them to come into interaction right now at the curbside or doorside. But you can find that document easily if you're a business owner at coronavirus.lacity.org/business. Check it out, start checking it off, and then let's all go check out those businesses. And for individuals, reminder, this isn't some sort of green light to slack off. We're only able to take these steps because of your vigilance and your brilliance in enacting what we have done for 2 months. Your willingness to sacrifice, but also your attention to shopping locally and helping support our neighborhood businesses. If you don't feel safe going for curbside or doorside pickup, then get what you need delivered from these businesses if you can. And that's especially important if you're a senior or somebody with an underlying medical condition. I know our seniors who can get out are itching to get out. It is still the public health recommendation. You are safer at home. That's what it's all about. We all are safer at home whenever we can stay at home, whenever we can work at home, whenever we can get a delivery at home. Continue to do that, and we can continue to flatten the curve of this virus. Our decisions are always based on data and science. So let me inform you about the latest data today. Today, the county reported 1,264 new positive cases, bringing our total to just under 35,000 cases in LA County. This was a 4% increase since yesterday, and the last 7 days have seen an average increase of 858 new diagnosed cases of positive cases of COVID-19. In the city of Los Angeles, these numbers were 545 new cases, with a total of 16,610, a 3% increase since yesterday. We're just 25% of the state population, but we're still about half of the deaths and half of the cases. And the toughest number always is to learn the number of deaths in the last 24-hour period. For us, that was 47 more Angelenos who we lost. The steady drumbeat reminds us of how serious this work is and what's at stake. We've now lost 1,659 Angelenos. This was a 3% increase since yesterday. And on average, over the last 7 days, we've lost 42 of our fellow Angelenos each day. Our hospitals still have done a heroic job, though, and all our medical professionals and administrators and janitors. And I want to give a special shout out to our hospice care workers who haven't been singled out. One of you wrote me, and I want to thank you for the amazing work you have done with people at the end of their lives who often can't even be touched by their loved ones, but you are there for them. But in our general emergency hospitals, we have 1,061 available beds, including 874 acute care beds, 187 ICU beds, and an inventory of 1,231 ventilators. Those ventilators numbers are a little higher, those bed numbers are a little lower, and our admissions into hospitals are a little bit higher, but still at a pretty steady rate, which is holding strong under the capacity that we have. And as I always remind people, get tested. And anybody with or without symptoms can get tested. Go to coronavirus.lacity.org/testing. I signed a friend up today myself, and there were dozens of openings just even this afternoon, and there are hundreds and thousands awaiting tomorrow. That's at coronavirus.lacity.org/testing, or you can call us at 213-978-1028, and we will fill out that testing for you, or call 311 after 5 p.m. At the 36 testing locations run by the county and the city, we have the capacity to test 20,000 people each day, and now we've tested nearly 320,000 people by the close of business. Our efforts to track and to stop this coronavirus all come down to a simple mission. How do we keep each other healthy and safe? But that doesn't just happen because we're adding testing sites. It happens too because of the extraordinary men and women who are working on our front lines. I've talked about them almost every single night I've addressed you. We have to take care of those heroes who take care of us. And we always take action to support our city's emergency responders, not just during a crisis, but they need us especially now. And right now, we're asking them to do so much more at our testing centers, transporting folks to our hospitals who are COVID-19 positive, our police officers, firefighters, our sanitation workers, our port and airport law enforcement are working extended shifts. And they're responding as they always do, just going, not looking to be a hero. They always tell me, Mayor, it's just my job. It's what I signed up to do. And we can never say enough thank yous to you. But we want to go a little further today because we want to do something to ease the burden on you and on your families. And with schools and early childhood centers shut down, we know that your mothers and fathers, not just police officers and firefighters and city workers, you keep us safe, so we want to make sure your family is safe. So tonight, I am announcing we are expanding our LA Emergency Child Care Connection Program to support our city's emergency workforce. As we've been doing this for a while already for our low-wage hospital staff who had no options, the people who clean our hospitals, who run the tests, who are the techs and other people who need the help. But starting today, emergency responders will also be eligible for this program. They can take advantage of child care referral services offered by the county, resource and referral agency, as well as We Care and Carina Care. And on top of that, LA County emergency workers can enroll in childcare at one of our 18 rec centers scattered throughout Los Angeles, where Rec and Park staff are already ready to provide supervision, academic assistance, and recreational activities to children ages 6 to 14 from 6 a.m. to 6 p.m. every single day. Each site will be following strict physical distancing guidelines and public health recommendations, and there's prepackaged meals and snacks. And I want to thank again the remarkable Recreation and Parks employees who are making this happen for their fellow city employees. Simply put, there are childcare resources available for our first responders through our city program as well as our county and state partners. To learn more, go to coronavirus.lacity.org/childcare. Now, we're doing everything that we can at the local level to deliver relief and assistance to workers and businesses who form the backbone of our economy. But as I've said repeatedly, we cannot do this alone. And so tonight, at a very important moment in our country's history, I want to call on our country's leaders to take action, to recognize that America is not made up from Washington to us, but from us to Washington. The first rounds of stimulus and survival packages were essential. We needed them, and they have certainly helped. They've been supporting our efforts on testing, on protective equipment, on small business loans, and direct assistance to working families. I know sometimes it doesn't feel like enough, but it's been a good start. And yesterday, Speaker Pelosi and House leaders rolled out the next step, a $3 trillion package that is called the HEROES Act. It's supporting folks on the front lines. It secures additional aid for renters and for mortgage holders. It helps small businesses and immigrant families who have been left behind by previous legislation. It provides funding for state and local governments so we can keep the vital services you deserve and that you depend on running and critical workers on the job. This cannot come soon enough. We, like cities and counties across this country, are making excruciating decisions about our budgets, what to cut, where to cut, and in some places even who to cut. We shouldn't be in that position, and Washington can help. So when the bill comes to the floor of the House this Friday, I hope every member, Democrat and Republican, casts a yay vote. And I hope that Senate leadership takes this up and doesn't make this a partisan political issue. I spoke with a number of mayors today, Republican mayors, Democratic mayors, up and down California, from the Central Valley and the Inland Empire to the Bay Area and Southern California. And we are unanimous across all of our political leanings that this is something we need. Don't leave any American behind simply because you want to play politics with this moment. It is time to come together and to take one more round that will help us take one more step forward. As we adapt to our new reality, we will not stop finding ways, large and small, to support our small businesses, especially as they start to offer curbside and doorside pickup. Yesterday, our Department of Transportation expanded its successful program with our restaurants, where we had zones that allowed for restaurant delivery pickups. And now any retail shop in the city of Los Angeles can get a temporary pickup zone permit. That means businesses can reserve a parking spot right out front for customers to pick up items so that there aren't cars parked there for hours and nobody stops by. For businesses and restaurants that apply and get approval, new signs designating these spots will be supplied and installed within 3 days. And I want to thank our General Manager, Salita Reynolds, and her entire team at Department of Transportation for the great work they have done with restaurants and now are doing with our retail establishments. If you're one of those businesses, go to ladot.lacity.org/retail pickup and apply for that permit today. This crisis has hit us all in different but in deep ways across our marvelous city. For some, it's been the pain of not being able to see a loved one. For others, it was hearing the news that the Hollywood Bowl wouldn't be open this summer for the first time in its history. But I want to tell you, it is not all bad news. We're still going to have a summer, even though there's no Hollywood Bowl open. You can hit the beach, see the beautiful view from Griffith Park or one of our iconic parks. As of today, you can go out, maybe play some tennis, and this weekend, already golf. Do those things that ensure that even in tough times, we have a modicum of a good life around us. We know that we've seen small businesses teeter on the brink. This is not forever, but it is certainly hitting us hard, and I never want to downplay how tough these days are. The psychological burden of this pandemic is heavy. I had folks who talked about just when they heard the news yesterday, how people felt so depressed that some even felt suicidal. But I want anybody out there to know that, first of all, it's not all bad news, but even if you're feeling the bad news part or the suffering that you're going through, personally or economically, you are not alone. Call someone, talk to someone, get help. And you can reach the county's Department of Mental Health 24-hour access center at 800-854-7771. If you have nobody to talk to, call that number. And if you're a LAUSD student and you're feeling depressed, you don't get your graduation, this wasn't the school year you thought, call for a mental health professional from LAUSD at 213-241-3840. They are here for you. I am here for you. We will get you the information you need, get you the help that you deserve, and we will always be here to remind you we do have steps ahead of us that will fill us with light and hope and momentum that will make things less bad. But we have to continue to stay safe, to stay healthy, and whenever we can, to stay at home. As always, I send you strength and love from the bottom of my heart in Los Angeles. Thank you for all you are doing, and let's take these steps together in the days ahead. With that, I'm happy to answer questions. First question,
and
please.
Our first question comes from Richard Adams with NBC News. Please go ahead.
Hi, Richard. How are you?
Good. Thank you, Mr. Mayor. My question is about outdoor sports for kids, specifically for this summer. I'm not talking about spectator sports, but specifically something like Little League, summer sports camps, tennis camps, something that whether you see this being a possible over the next few months in the city of Los Angeles, that where we can put our kids in activities this summer.
Yeah, as a parent, something I've been thinking about every day. Right now, that is not the guidance. It's possible, but I don't think it is extremely likely right now. I think it's really important for us to know that this is about as dynamic a situation as we'll ever face. Anybody who predicts what things are going to be a month from now, we can't tell for sure. But I'll give you this promise. If our numbers stay strong, we'll keep taking steps forward. And we'll always ask our public health officials, can we do these things in a safe way? I know camps are thinking about, can we do camp in a physically distanced way the same way schools are thinking about that for the fall? And if they can present that to the county, get that sign off from public health, absolutely, it's a possibility. But certainly some of the group sports that we're used to kids playing, where you interact closely with each other, those dangers will continue to be there as long as this virus exists. So, part of that is our ability to test. Part of that is going to be our ability to get a sign off from county public health. And part of that will just be using good common sense. So my opinion, which is just as good as today, is that it's probably going to be tough, but it is possible. That said, I do hope that we can look at safe ways that we can take care of our children this summer. If, as I announced today, that we're offering childcare in our city's rec and parks facilities for our first responders, that means that we can put children 6 to 14 in a safe environment, physically distanced, and there's still going to be some activities. It might not be as close as activities we're used to, but it gives me a lot of hope that we can find those spaces and those places for our children this summer. And let me tell you something, we better find them now and in the fall, or else a lot of parents aren't going to be able to go back to work. So I see this as critical not just to our children first and foremost, but also to our economy and those parents who depend on this for childcare. So we'll keep working very hard on that. And lastly, I'll say there is a working group looking at this and seeing what we can do, at least at the city level. So hold tight, and hopefully in weeks coming forth, we'll have some ideas. We'll share those with the county. And if we get any green lights, we'll share those with you. Thank you. Next question, please.
Our next question is from Emily Alpert Reyes with Los Angeles Times. Please go ahead.
Hey, Emily, how are you?
Hey, how are you doing?
Good. Yourself?
Good. I wanted to ask you about some federal documents filed today in the City Hall corruption probe.
Yep.
Prosecutors indicated that one of your deputy mayors arranged payment to assist a real estate project while he was still working in your office. The filing also says that your deputy mayor pressured other city officials to take actions to benefit that project. What can you tell us about these allegations, about the person who they appear to be involving, Ray Chan, and your reaction to them?
Well, my reaction is clear. I think anybody who knows me knows I have zero tolerance for any unethical behavior, not just in my administration, but in City Hall and any public service. I'm the son of a prosecutor who stood up the first division long before he was DA that went after public officials, appointed or elected, for corruption. And I have absolutely no tolerance for that, and it sickens me. I don't know anything more than what I read as well. The deputy mayor that you referred to was deputy mayor for less than a year in an acting capacity here, but that doesn't matter. When one person does something like that, he soils everybody here at City Hall good public service. Just as we saw police officers do in a Rampart scandal and suddenly all were painted and tainted by that brush. One person, if they're determined to do bad things, I've learned, can do them. But if anybody here has any information, I've told people from the beginning, I expect them to share it. And if anybody's broken the law, I expect them to pay the price. And if he or anybody else has broken the law, I hope they get the full extent of punishment from the law as well. Thank you. Next question, please.
Our next question comes from Emily Guerin with KPCC. Please go ahead.
Hey, Emily, how are you?
Hi, Mayor Garcetti. Good, thank you.
Good.
I wanted to ask, are you aware that stylists and barbers in Los Angeles have been making home visits to do haircuts as a result of salons being closed? And if so, how much of a concern is this to you? Is the city doing any enforcement? And lastly, have you yourself gotten a haircut lately? And if so, how?
I did get a haircut. It was from my wife, and I ordered on Amazon some electric shears. I've only had one cut. As I joked a few weeks ago, I'm told it's not that straight in the back, but I think she did a pretty good job on the sides and the front. That would worry me. It is something that is not permitted. I understand how tough it has been. We all have very close relationships with people who cut our hair. We sit, for a half hour and talk to them. We know them well. They know us well. It's a moment of relaxation. And for many people, something that's really about how they feel about themselves. But the state has been clear that is a phase 3 or stage 3 activity. It is one of the more dangerous and risky activities, even done with appointments only. But I know that Dr. Ferrer has looked at this. This is, again, a county call, but certainly my advice is that let's get through this phase 2 before we move on to those riskier activities. And they should be done in the way that at least you described. Initially, by appointment only, limiting the number of people in that space, cleaning those spaces, the same things that offices, manufacturing, retail is having to do as well. And we don't know when that's happening. We don't know that it's being done safely. So we haven't had any, I think, city inspectors enforce that. The county, maybe you should ask them if the county has had to do that on the health side. But as always, if we hear about those, please let us know. We're not looking to crack down on people. We'll educate first and let them know in case they don't know. Then we'll encourage them to stop, that we know that's happening. And if necessary, we can enforce. But for me, that's always last thing. I don't want us to turn Los Angeles into some sort of police state, but people do need to know it is dangerous to do this. It's not permitted yet, and they should be waiting. Thank you. Next question, please. Next question.
Our next question comes from Claudia Pescherado, please, with KNX News Radio. Please go ahead.
Hi, Claudia.
That's enough. Thank you. Okay, a couple of questions, Mayor. So if you could tell us a little bit more about how the Slow Streets program is going to work and, where the street closures are going to be listed, that sort of thing. Also, I keep asking questions about the lag time on test results, but I just want to mention to you, a journalist and two of his friends who I know got tested at the VA site last Wednesday. One waited 5 days, the other one got results today, and another one is still waiting. I keep hearing from people who are waiting many days to get their results. So I'm wondering why that might be, what's being done to address that. And also I'm wondering if you've been directly affected by the coronavirus crisis, if you know anyone who's been hospitalized or has died, and whether that's changed your response to this at all. Thank you.
Let me start, because the last question in some ways is really the deepest one. And, I started talking to some folks. I was talking to somebody actually in Great Britain who I know, who said, in England, where they're seeing, I think, the highest infection rate in Europe right now, where the deaths are maybe half to a third of what New York City went through. But it's getting to that point where this person said, now we all know somebody. We either know somebody who's died, or we have a close friend who has a loved one who's died. Absolutely, I know people. That comes with being mayor. I've talked to a police officer who lost his young wife when he was asymptomatic, who out of nowhere and perfectly healthy is gone and no longer there for their children. I've talked to folks across the country. A dear friend of mine in New York whose father died in New Jersey in a senior nursing facility, and I went to the virtual funeral online. It's those moments when you realize, as much as people are so anxious and say, open up, or some people are on the streets honking, give me back my freedoms, that this isn't about government doing something to all of us. It's about our collective decision of whether we think lives are worthwhile, that they're worthy. And we will go through many more deaths. We will have to counsel each other. They will pile up, even if we keep this steady pace. Each night when I say these numbers of 41, 49, 52 deaths, those are real stories. And in a county as connected as we all are, we're all going to know it. And I've predicted that the United States will have at least double the deaths that we have today by the time this is done, possibly even triple. That is a pretty depressing and heavy thing, and it certainly guides my decisions, but it hasn't changed, Claudia. Even before I knew anybody who had died from this, that was the guidance I had from the very beginning of this, looking at just the horrible stories in history, past pandemics, and the impact that it had on people. In terms of the testing, absolutely. I think, the numbers, I keep getting back, we're getting that from the lab, but there was no question that in the last 2 weeks, as more tests were added, that test time slowed down. I'm still trying to get a new average. That 30-hour one was the average when I gave it to you both times. But I also have had that anecdotally from some people. Some people get it in 24 hours, and others I've talked to, it took 6 or 7 days. And when I asked today why, it's because all the labs in this country, and certainly the lab that we use, is just crushed. So we need to bring that number down. The speed with which we get this diagnosed, the indicators that I hope the county adopts, that we're looking at, the standard really is to be able to get test results back within 24 hours. Now, no place in America can do that yet consistently. We came the closest when we were at 30, but we've seen it probably go up a little bit. The reason that's important is this isn't just about letting somebody know they're sick, but at the time that is going and elapsing for us to contact everybody that he or she has been in contact with. That's how we're going to open this society up and still slow the virus down. So it's absolutely critical, and I'll get you new numbers as soon as I can. And then the slow streets piece. So this has been a really, organic process. We didn't want to just do one small area of town, and Dr. Frere didn't sign off when it was just going to be 1 or 2 places, because there was the worry everybody would rush there and there would be such huge crowds as we saw beaches in Orange County and other places. Now that there's been 3, 4, 5 neighborhoods that want to do this, it's usually come from the neighborhood councils, it's come from the council members, and we're going to have an application process. I don't know, do we have the web address for that yet? Okay, it'll be up by tomorrow. I know that they're working on it right now. But a web address where people can go, fill out the forms, and say, we propose, these 10 streets. We'll have our street services and Department of Transportation come in, make sure there's good sign off. We're asking for folks that live in that neighborhood just to be the eyes and ears to let us know if things are getting too crowded, because we don't want it to become a public health danger. But it really just crystallizes what we're already doing in our neighborhoods. We've all never seen so many people walking in LA, out there biking, jogging, and we need a little bit more space to do that. So we're not all doing that kind of snake S-turn around each other on sidewalks and going into the street where cars are still allowed. So the first ones, now that we have the permission from the county, will go this weekend. It's also, to me, a very important social equity issue, because while the recommendation from the county is, not the recommendation, the order is we still have to keep parking lots by the beach closed. Some who live close to the beach can walk there and get there. Public transportation's one way. But for all the rest of us that live inland, we need to have spaces too that are open where we can refresh our minds, get out there, get out of the house for a little bit as well. So we're really excited to do that. And I think it'll be a great experiment for Los Angeles. We've all enjoyed being outside. Maybe we'll learn some lessons for some permanent closures in the future, but at least for now, we'll have safe places for us all to be. Thanks for your questions. Next question, please.
Our next question comes from Robert Kovacic with NBC. Please go ahead.
Hey, Robert.
Mayor, good afternoon. Forgive me, I ran off the set because we were talking about the closure of the Hollywood Bowl, which
Sure.
I'm sure you agree is, a real gut punch to a lot of people. A couple of things here, and we're just trying to gauge the tone of your remarks regarding the face masks, which now appear to have gone from a stern recommendation to a requirement for Angelenos. And if you could elaborate on that, what that means.
Sure.
Also, I just need some help dumbing this down for me, because we quote these numbers and we talk about a 4% increase from yesterday in the total number of cases. And we talk about that we have increases here in LA County. When do these numbers start to look good to us? When do we start to say that these numbers are actually trending in a way that makes us more comfortable about opening? Because there's a lot of people who see these numbers and reluctant.
Absolutely.
And are very reluctant about going outside, very reluctant about anything reopening. So, and with that said, and if you have time, let's talk a little bit about our wildfire preparedness, after our firefighters have been through so much over the last couple of weeks, helping out in every way they can. And the governor was talking about it. I'm just wondering, how do you feel about our preparedness? Sorry to hit you with this.
No, don't worry. I love multiple questions. Don't worry. We don't get to see each other face to face, so I appreciate this. First, let me start with the wildfires. We are absolutely as prepared as we always are. We're never unprepared in this city. We have such marvelous firefighters led by Chief Terrazas. Training hasn't gone down. If anything, there's been fewer transports because fewer people have been going to the hospital. There's been fewer accidents out there, et cetera. So more transports for COVID-19 over time, but fewer overall. So we feel well-staffed, we feel well-trained, and we feel ready. But it's everybody's responsibility. Remember, keep your eyes out when it's dangerous days. Take those warnings seriously as we get into now almost year-round wildfire season, which used to just be a few months given global warming and everything else. And I know that our firefighters will continue to not only do a heroic job if there's fires in the city of LA, but with mutual aid for LA County and our surrounding counties as well. Second, when can we feel good about the numbers? This is something that I think will roll out in the next week from the county. Not just what are we measuring, but what are the goals? What are the goals for the number of beds that should be available? What are the goals for the number of tests per day that we're doing? What are the goals for the number of deaths or below that we can open things up? We want goals, of course, for instance, deaths to be zero, but we recognize they may not be each day. So what is acceptable? For me, the metric is 14 days of stable or decreasing deaths. When they're going up, you better worry. You better not be opening things up. And by that measure, for the last 14 days, now probably 17 or 18 days, that has been steady. If you look at hospital beds, we've certainly been able to see steady capacity well under what our capacity is. We're one of the only cities in the country meeting testing minimums. The recommendation is, let me get this right, 1.5 tests a day for every, 1,000 people, whatever the equivalent of 15,000 tests for LA County, 10 million people is. We're doing about 20,000 tests a day. So we're above that minimum. So we're hitting a lot of those things. When you hear the word increase, It doesn't mean the rate is increasing anymore. That's the flattening of the curve. That curve doesn't describe the number of overall cases. It just describes the rate at which they're increasing. That rate of increase is now flat. That's what we've earned. That's the victory we've all achieved. But when we say the number of cases increase, of course, as long as you have one case, it's an increase from the day before. That's an overall count. So it shouldn't necessarily worry you, because remember, it's an overall count. The great majority of the people who had COVID-19 in weeks past are now over it. They're now healthy. I wish I had that metric, but that's a tough one to count. And I know we haven't been able to get that really in the state in the way that we wanted to. But most of those numbers are not that we now have 34,400 and something people that are sick today. That's the overall count during these past couple months or 2.5 months as well. So most of those metrics are moving in the right direction. We're starting to hit all those goals, which is why I felt confident supporting the recommendations of the county that we worked on to open up what we've opened up this weekend and are opening up this week. In terms of the first question, the face covering order, it wasn't just stern advice before. There was a mandate. Whenever we were at pharmacies, whenever we were in grocery stores, whenever we were in any of the places that were open as critical businesses, construction workers, those were all mandates. So it's just taking that mandate, recognizing, hey, more is open, so there's more threat. Let's make sure we're not infecting each other. Remember at the beginning of this, we had all our trails and parks open. People weren't physically distancing, and the jury was out about face coverings. I'm proud that LA led that movement in this country, the first big city to say not only we strongly recommend it, but you have to then do it in certain locations. Now, with advice from public health, county, we concur, wear it whenever you're out and coming into contact with anybody. So just take that face mask with you whenever you leave the house, because you are going to interact with somebody who isn't a member of your household. In those rare moments where you're somebody who could never physically run into somebody else and you're just jogging by yourself, maybe you can get away with not having that on, but have it with you just in case. And that is now that order moving forward. Thank you. Next question.
And our next question comes from Steve Gregory with KFI News. Please go ahead.
Hey, Steve, how you holding up?
Hey, Eric. Good evening. I was going to keep it to a couple of questions until my colleague, Mr. Kovacic, started asking.
It's going to go from 2 to 3 to 4. Take 10.
I'm going to go ahead and give you some rapid fire here.
Okay.
First of all, with respect to the economy, with the indefinite extension, as Dr. Ferrer said today, the indefinite extension of the safer at home order, what's the fiscal health of the city going to be like toward the end of the summer? And I know you're having to look that far out. Also, earlier in your speech, you talked about being pissed off, and I wanted to know if you could give us the backstory on what prompted you to say that. There's a story or something that you heard that prompted you to say that. And also, can I get your wife to cut my hair?
No, she's not part of your household, but you can borrow my shears. I'm more than willing to sanitize them and send them your way. Though I do look forward to getting back to my barber. In terms of the second question, there's no backstory. It's more like when I hear people saying, do this or do that, just because, when people say, oh, I can get away with something, that does piss me off. I showed a little bit of emotion of how I feel, but I know that 99% of people are working hard to do the right thing, to earn these steps forward. And it's true, 1% of people can screw this up for everybody else. So there's no backstory. It's just, every single day, we know this in everything we do in life. There are the great overwhelming majority of people who understand this is about our collective health, and then there are those who would kind of thumb their nose at it. And I think all of us should be pissed off when we see that and help educate them, encourage them, and if they stay with it, we'll have to enforce. In terms of the first question, it's bad, simply put. Our fiscal health, like the fiscal health of every city and county across America, in red and blue states, it has nothing to do with who's run cities and who's run states. It is equally felt. The Republican mayors of, Mesa, Arizona, and Fort Worth, and Oklahoma City, who I'm on the line with every day, we don't say, oh, you're a Republican, you probably don't need to fill a fiscal hole, or you're a Democrat, you probably don't care about this. This is universal. All of us are looking at what sort of furloughs, cuts, layoffs, services that are going to be reduced in the midst of a pandemic when we need these local services the most. Today, we learned that thankfully the county gave everybody permission to pay their property taxes without a penalty later. That resulted in us having $90 million less than we expected to get this month from property taxes that are passed on to us from the county to the city. And the other 87 cities across this county have proportionally similar numbers. So now we have to sharpen our pencils and figure out, how do we even do cash flow to make our payroll? Where do we have to make cuts, et cetera? That's why this HEROES Act is so critical on Friday's vote in the House. And when it passes, the Senate and the President, who himself said after the last package, now let's take care of states and cities next, should step up and fulfill that word and help all of America as embodied by our local communities to get the job done. And one last thing I'll just say, it's kind of where I started. The county didn't say necessarily an indefinite extension of the order as is. And I know you didn't say that, but I want people to know there's health orders all around the world and across America in every jurisdiction. There's no jurisdiction that has said we are 100% out of the woods and there is no health order. So when the county and Dr. Ferrer says, of course, it's going to be there for a few more months, she was making a small point, not dropping a ton of bricks. It's certainly the way I heard it. I'm hoping that this has reassured people when I clarify it. I certainly talked to her last night. She and her people are doing a marvelous job. We're lucky to have her. Our Board of Supervisors are doing a great job as well. But we are going to do that hard work of making those tough calls, of opening things up in a steady way, as long as our numbers stay stable. That's my promise to you, both to protect our health and to protect our economy. I understand that is the last question, so I'm going to switch over to Spanish. And again, thank everybody who has tuned in. Appreciate you. Appreciate your understanding, and be hopeful. And when you're depressed and when you're sad, talk to someone. And we will be here for you whenever you need us, every step of the way. Muy buenas tardes, Los Ángeles, y gracias por venir.